Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. In this segment, we're going to have a conversation with Maya Ram. She's clinical specialist at Ergotron. Ergotron are makers of ergonomic products. She's joining us this morning to discuss the release of a healthcare ebook that focuses on the health and well-being of hospital workers amid the pandemic. Welcome to Health Professional Radio. Maya Ram, thank you for joining us this morning.
Thank you, Neil. Thank you for having me on.
Well, tell us a bit about yourself, a little bit of your professional background, and then talk a bit about Ergotron.
I have a background as a registered nurse, but I have a total of 10 years of healthcare experience in total. I also have a background in clinical informatics, which I earned that degree while I was working full-time as a nurse. My experience in nursing has been mainly in acute care, so that's the hospital, in a variety of areas, including medical, surgical, the emergency department, cardiac care, and also post-anesthesia care. My interest in informatics began because I could see the various pain points in the use of technology by clinicians, and I wanted to go into that field to help make things better and easier for clinicians to interact with technology. After I graduated with my degree in informatics, I started working for an EHR provider, Meditech, which has the third largest market share. I've also worked as an implementation specialist for the Roland Nurse Call system. I supported them working with the vendor. I now work at Ergotron, which has been for about a year. What drew me to Ergotron is the attention they pay to ergonomics and being able to facilitate the ease of use of technology for clinicians. And that is especially important in these days. Ergotron makes a variety of computer mounting hardware. It's ergonomic for different verticals, including and especially healthcare. And we have done so for the better part of 25 years. With our products include stationary wall-mounted workstations that can be used in a sitting as well as standing position, and also mobile carts to facilitate those workflows that require going from place to place rather than being stationary. And those that too are sit to stand. We also design our products to accommodate the various accessories that are now used in healthcare. We have received awards in design of these products, as well as to certify full BIFMA range, for example. That's a measure of full ergonomics, the sit-to-stand range.
Before the pandemic, healthcare workers in all capacities, in my opinion, were pretty strapped, stretched to the limit. The pandemic, though, just brought it to another level. I understand that Ergotron conducted a survey that included clinicians and health IT workers to find out what were some of the reasons for that. Tell us about this survey that Ergotron conducted.
Yes, absolutely, Neil. So last year, Ergotron conducted a survey of 500 healthcare workers, half of them being caregivers like nurses and doctors, and the other half being healthcare IT professionals. So think sysadmins, IT support, IT managers, etc. We were curious about the experience of these two groups, those who work face-to-face with patients every day and those who keep tools and technology running 24/7, which is necessary in healthcare. We wanted to know how the pandemic was affecting those two groups. What was the impact on their overall well-being, their perceptions of their work environment, and their thoughts on the work landscape going forward. We found that clinicians and IT workers just don't look forward to their workday. Now, that might not seem shocking given the stories we've seen about how tough the pandemic has been on the healthcare system, but seeing the result was still disheartening. We found that less than a quarter of healthcare workers, about 22%, are excited to go to work, and this number drops to 15% for direct caregivers like nurses and doctors. So think about that. That means 85% of caregivers don't look forward to their work. Becoming a clinician, a nurse or a doctor or any other role, it's a rigorous process, and it takes years of specialized training, and then at the end you have to get a license, which you have to maintain for as long as you are in the profession. This is a job that people really want to do, that they're driven into this role for a variety of reasons. Nurses, doctors, and people in other clinical roles they're very passionate about helping people in general. But the sad truth is a variety of factors that were intensified by the pandemic have just put an immense amount of stress and pressure on healthcare workers, and the result is a workforce that's exhausted.
You mentioned a variety of factors. What are a couple of those factors, and what do the findings of this survey basically say for the healthcare industry as a whole going forward?
So we also asked about the work environment. We wanted to know how common it was for clinical and non-clinical employees to experience work-related injuries and health problems, and we found that both caregivers and IT pros reported similar rates of aches and injuries, including neck and back pain and overall exhaustion. We're seeing that these injuries and health problems are common in healthcare, no matter what your role is, whether you're face-to-face with patients or working in IT. A substantial portion of employees experience pain. Half of caregivers and 45% of IT staff reported neck pain. 46% of caregivers and 37% of those working on IT teams had back pain. And 36% of both groups report feeling exhausted. Now, another factor that's become more prominent is virtual care. We know the rapid shift to telehealth was a big change in how some caregivers provided care, and we wanted to understand that impact as well. It was unsurprising that 68% of caregiver respondents reported that virtual care played more of a role in their work than it did before the pandemic. And yes, there are some clear benefits about virtual care that healthcare providers appreciate, like being less exposed to infection. There's certainly downsides as well, though. 87% of caregiver respondents had concerns about the physical impacts of using telehealth technologies, such as spending more time seated, and that contributes more to the pains that I talked about earlier, neck and back pain.
So where do ergonomics come in? How do they play a role in the healthcare space to address some of these physical difficulties?
Now, any ergonomic solutions will certainly vary based on someone's role, but at a minimum, anyone in healthcare, whether they interface with patients or not, they need the right tools and equipment to carry out their jobs responsibly, safely, and comfortably. Like, let's take nurses and doctors, for example. They work with patients and then they document their information in an electronic health record software. Caregivers can commonly spend half their shift or more on the computer. So in that respect, there's a lot of commonality between caregivers and those in IT. Everyone can spend a lot of time in front of a screen. They all need a place to work that fits them and is comfortable. That means the height of the computer monitor should be adjustable. The work surface or desk height should also be customizable, allowing for a comfortable position, sitting and standing. Caregivers might need an opportunity to sit and rest as they enter their information into the electronic health record. IT team members might need the freedom to stand part of their day to avoid the aches, pains, and health risks that accompany long hours spent seated. And at Ergotron, we create solutions designed to solve those very problems. Medical carts and wall-mounted computer workstations that offer height adjustability and plenty of customization. Optional accessories help improve workflow and keep tools and supplies at caregivers' fingertips. That's where we come in.
Give us a website where our listeners can learn more, if you would.
Our website is www.ergotron.com. This is where you can see the variety of products we offer and the different verticals we offer them in. It's where you can see the wide variety of our solutions we provide.
And that's www.ergotron.com. Is that correct?
That's correct.
Maya, thank you so much for joining us here on Health Professional Radio this morning.
You're welcome. Thank you for having me on, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Maya Ram, clinical specialist at Ergotron. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.